Welcome to this exciting edition of Facebook Live. We're going to all survive this edition very, very well. I know we will. Thanks for joining us. As always, please submit your questions. Today I have two very special guests with me today. I'm Dr. Michael Furlong, Medical Director of Furlong Vision Correction. We like to do these Facebook Live segments periodically. To my left is a very special guest, two-time contestant on Survivor and actually sole survivor of Cambodia edition. So this is Jeremy Collins, a patient of mine. We're going to talk with him shortly about his vision correction procedure that he had a few months ago. And to my right, Andrew Savage. Many of you have seen him before on these segments prior. And Andrew's also a patient of mine, two-time survivor contestant as well. And
two-time
two-time loser. Oh, okay. Well, we don't. I disagree with that, but we'll talk about. Not everybody could be the sole survivor, I guess. Is that right? Okay. So we'll talk with Andrew just a little bit about his experience. So, you know, when we talk about vision correction procedures, the most common one that's done is LASIK, and I'd like to point out right here and now that neither of these two had LASIK, the most common procedure that is performed nowadays. And the reason they didn't is because it wasn't their ideal procedure for their eyes. Jeremy had a procedure called advanced PRK, and the reason I recommended PRK to Jeremy, even though his prescription was pretty significant, he had very thick glasses, he couldn't even see the big E up on our eye chart.
Was it an E or an H?
F, I think.
Oh, right.
The reason we had recommended PRK is because his corneas were too thin for LASIK, and if you do LASIK in a situation where either the cornea is too thin or some other reasons, it can be risky. And so I didn't recommend that to him, and we explained to him that he'll get the same results, but it's just a bit of a longer recovery. So in the PRK procedure, we don't make a little flap on the cornea. We just do all of the laser right on the surface. It takes a little bit longer for the skin cells to grow back, but once it does, the results are the same. And I think you're now 3 to 4 months out. We did your surgery back in January. Jeremy lives on the East Coast. He's in a suburb of Boston and has been seeing my colleagues out there for postoperative care. The last report I got was that you were seeing 20/20. So Jeremy, welcome, and please talk a little bit about your experience and how it might have impacted your being a contestant on Survivor.
So, my name is Jeremy Collins. 40 years old. I was on Survivor 2 different occasions, season 29 and season 31. So when you're out there, you know, you can't see anything, and you can never get clean. Your hands are always dirty. To put in contacts every day, it's just a pain in the neck. And I have infections, and I had scratched corneas, and my eyes were red, and it's just terrible. So coming in, and Savage told me about Dr. Furlong and said, you know, he's a miracle worker. He's going to change your life. And I trust Savage. So I said, I'm going to come in, and I talked to Furlong, and I said, all right, let's do this. I'm going to take a leap of faith, you know. And it's unbelievable. So PRK it takes a little bit longer to get to 2015 or 2020, but every day I could see better and better. You know what I mean? And so Savage told me, he said, patience. He said patience. He said, find a spot in your daily living. You know, like look out the window, find a tree, a street sign, something, and focus on that. And every day, go back to it. And every day I do, and it gets better and better and better. It's unbelievable. Like, I can't imagine playing now with my vision like this now. I can't even imagine it.
And what did it take? How many minutes to correct your vision?
It was 2 minutes an eye or something crazy like that. It was just like that. It's so simple. No pain during the procedure at all. In and out. It's unbelievable.
So tell us a little bit about, I mean, I know in real life, when you're not competing on Survivor, you have a real job. You're a real hero in my book, because you do one of the most difficult jobs that's out there. Please tell us a little bit about what you do.
So back home, I'm in about 20, 30 minutes south of Boston in Foxborough, Massachusetts. I'm a firefighter in Cambridge, Massachusetts. I'm married. My wife, Val, was actually on the show with me the first time I played. And we have 4 children. 2 girls, Jordan and Cameron, 2 boys, Remy and Lennox.
And you got a little one too.
Yeah, Lennox is 10 months old.
That's awesome. And as part of going through the procedure and learning a little bit about it and then realizing what you can achieve, I mean, you touched on it a minute ago. if you could project and how it would be if you were on the show again, and what the competitions would be like, not having to imagine dealing with dirty fingers, contacts.
And that's just scratching the surface. Like challenges that you're going in the water,
Yeah.
you know, like regular people don't even think about that. You know what I mean?
Yeah.
Like I watch the show and I would say, oh, I can't do that because I can't see under the water. You know, like there's no way I can do this. You know,
Right.
my contact would fly out of the water and I'll be done. And now, like I say, oh, I can do that. I can open my eyes. I just go right down there and untie that rope, grab the cone or whatever it is. You know, like regular people don't have these issues. You know.
So I would just add that our vision before Dr. Furlong was literally a handicap. Right? Since second grade, I was legally blind. Coke bottle lenses since second grade. So in life, and especially on Survivor, it's a handicap. And you got these amazing survivors on the show who have perfect vision. And here we are stumbling around with glasses and contacts in the water. Contacts get washed out. I actually, in Cambodia, had an eye infection because, as Jeremy said, you cannot get clean.
Yeah.
Putting in contacts.
Yeah.
So for the first week on Survivor, in the All-Star season, I wore glasses.
Yeah, that's
Unbelievable
right. That's
disadvantage.
Yeah, yeah, huge disadvantage, especially because I know how much of a prescription you guys have. There are people that come in and, you know, they say, yeah, I wear my glasses when I need them, you know, I can drive without them. It's just, I just need it a little bit clearer, and you guys are ones that could see literally, what, 5 inches
I
in
tell
front of your
everybody
nose.
that if this was the wild and I was an animal, I would have been dead a long time ago. You know, like I couldn't survive.
Well, you can't react fast enough to something coming at you when you can only see 6 inches.
I wouldn't be able to hunt. Like, I wouldn't be able to do anything.
So you
know?
went from being the prey to the prey.
Thanks
to
That's
Dr.
right.
Furlong.
That's
That's
right.
awesome. Well, and I had learned just yesterday, that your wife was on the show with you.
Yes,
I didn't
yes.
realize that, and that's great. Was it interesting competing? Because I understand you competed against her.
Yes,
actually.
on actually it was day one.
Oh, okay.
We competed in a challenge against each other,
And who won?
I won. I won, but that is still
Wouldn't
not good.
recommend that.
Yes, I do.
Healthy
Don't do
marriage.
that. Don't do that. Let her win. You know. But I mean, it's a different aspect to Survivor. The Survivor's hard enough with trying to trust people that you don't know, and you can never trust anybody, and then to bring someone you love and try to get on the same page with them at different tribes, and it's not fun.
Yeah.
It really is not fun.
Well, I love that story. That's great, and I did want to touch on you, Savage, because for a different reason, LASIK wasn't appropriate. In fact, you told me a story before I even did your surgery, where you were ready to go and have LASIK. You had gone to the center. You were ready to roll. I mean, everyone has LASIK, and let's do LASIK. And you get there and they say no. And a different reason, had a similar prescription, but his corneas were also not appropriate for LASIK. And one of the things that I recommended for you, just because of the fact that the eye, as it gets older and you need glasses for distance and near that are different when you get into bifocals, that there was a better option for you called a refractive lens exchange, because we can put multifocal lenses in nowadays that help you to get that full range of focusing. And it's been over a year. You told me the other day that your vision's still very impressive and you're really excited about it. Tell me a little bit about how going through the refractive lens exchange was.
Yeah, so refractive lens exchange sounds daunting and horrible and invasive, and it's not. I mean, I was in and out within a half hour and pain-free, and literally went from being legally blind to having 20/20 vision. And then I had a PRK procedure to get me to 20/15, and I told Dr. Furlong the other day, this is amazing, so I told Jeremy, pick out that one spot that you're familiar with and you take a snapshot in your eye, and every day you look at it and just crisper and crisper. Even in the last 30, 60 days, my vision has even gotten crisper. I swear to you, I can see half a mile away and I can see a squirrel in a tree.
Yeah.
It's unbelievable. And this is near, far, and mid-range vision, which is the brilliance of Dr. Furlong and the technology that he uses and the sophistication of the lenses. That's what he can do. What I also love about Dr. Furlong is I went to a bunch of eye surgeons, a couple of which said, yeah, we can do LASIK, and I am confident that I probably would have gone blind because of the thinness of my cornea. And Dr. Furlong is all about the safety and best interests of the patients, and he is so skilled. He has all these different options for every single patient. And this is the example. Jeremy is very different from me in terms of his eyes, and I had stigmatisms and all these problems, Dr. Furlong said, here's what we're going to do. And he delivered on every single promise and some.
Yeah.
It completely far exceeded my wildest expectations.
Well, and it's a good reminder to think that not everybody can be fixed with LASIK, because even though LASIK's a great procedure, it's not for everybody for obvious reasons in your cases as well. And that if there is a technology out there that can benefit you, I'll tell you about that. And if there's not, I tell even patients nowadays, maybe you should wait a year or two and see, because your situation may even be more complex. So we're going to take a few questions here in just a little bit. Did you want to add anything else? Because it's been over a year now.
So what I will add is that I thought at some point, like living in paradise, you get bored of paradise, and I would become used to the fact that I'm not legally blind anymore.
Yeah.
And I'm not. Like I wake up every day and I'm driving to work and I can see 20 cars ahead of me, some jerk cutting people off. And I can read that license plate. I'm like,
Make a mental
I got
note.
your license plate. Thank you, Dr. Furlong. So I just, it's not, I don't take it for granted. Because it is a gift. You're literally giving us a gift.
Yeah.
So do you guys belong to some private Facebook chat group that's for survivors? Because I'm wondering if I'm going to be getting some phone calls now since you're greasing this pretty well. Well, let's take a few questions, because we've got about 3-4 minutes left.
Well, here's one that I have actually. What are you all wearing on your necks?
Oh, so this is cool. So this is called the Savage Koru. It's made out of bone, handmade in New Zealand, and the Koru stands for New Beginnings in Deep Family Love and Commitment. And the carvings on one side is the Scottish, I'm Scottish, symbol for courage, and the other one is the Celtic symbol for honesty. So raised my family based upon those beliefs, and so I share these very sparingly because it means a great deal to me. So
Special.
Jeremy's like a brother. I gave him one. Dr. Furlong gave me the gift of vision, so I gave one.
I got the gift too. I love it.
Yeah.
Okay. This is from Sumera. Hi, I've been told I am not a good candidate for LASIK. I can't see without my glasses. It's pretty bad. What are my options? And
Wow, perfect question for today. Now, not everybody is a LASIK candidate, but what we need to find out is what is your prescription? Does that prescription correct your vision very well? And if it does, then I'm optimistic we can help with possibly PRK, possibly lens replacement. There's even another procedure that is called an implantable contact lens that we haven't touched on today that's also an option as well. It really depends on a few different factors. I'd invite you to come in for a no obligation, no cost consultation to see what might benefit you.
Okay. This is for the two of you. Are you going to be back on Survivor now that you can see?
Well, I'm going to be back on because I have perfect vision now, and I'm going to beat Jeremy. just I want to be clear on that.
Is there any way I can write a recommendation? Please put them back on.
I'm ready to go back. And I don't know, how can I win again now? Can I win? Are they going to give me more money? Because now I have perfect vision.
So it's almost an unfair advantage for us to go on now because we have perfect.
Well, maybe
vision.
we shouldn't mention it to the producer.
No.
You say no.
Quiet.
This is a question from Tommy. Does your eyesight change as you get older? And if so, do you have to have the procedure again?
Well, so Tommy, your vision in one way doesn't change as we age, but it does in other ways. So your distance vision, if you wear a pair of glasses or contacts for distance, that usually levels off in your 20s. The prescription doesn't change a whole bunch. But what does happen in your early to mid 40s is your up close vision starts to get a little bit weaker. And so if you do wear glasses all the time, what you'll find is your glasses won't work when you're looking up close. You'll either have to remove them or go get a pair of bifocals. And that's just a normal aging process. One of the things that a refractive lens exchange addresses directly is that issue. The lens of the eye becomes less flexible as we age, and we replaced his lens, so he doesn't have to worry about that problem any longer. Now, you're going to get there.
Right.
We have other ways we can address that, but that's the breadth of what vision correction procedures can do. And for lens replacement, we can actually address that aging eye phenomenon when you get into your 40s and 50s.
I just want to add one other quick story. Since the surgery, we go out to dinner with friends and so forth, and the menu, no one can read it, and they always point to Savage and say, hey, dude with the bionic eyes, what is this? And then I can read everything.
That's awesome.
And these are even younger people. They're like, go to Savage, what does this say?
That's like us at the fire department. we go on a call and you have to read the board or read the fire panel and they say, hey, get the young guy. I'm not even young anymore. Get the young guy, read that. I don't have my cheaters on me.
Any other questions?
Do all LASIK doctors provide all of these procedures you've been talking about?
Well, to be a LASIK surgeon, you actually first off have to be an ophthalmologist, which is a medical doctor who does a residency of 3 to 4 years of training in all eye diseases and surgical procedures. And then there are doctors that spend an additional year or two specializing in different parts of ophthalmology. So my passion was the front part of the eye, which is cataract surgery and refractive surgery, LASIK, PRK, RLE. I have found that not all doctors will offer all of the procedures. Some may only offer LASIK and PRK and don't do cataract surgery or lens procedures. Some do the opposite. They were trained and are great cataract surgeons, but they don't do LASIK or PRK or lens implants of any kind. So it's a passion of mine to offer both. I think there are a lot of good doctors out there that do offer all of these procedures, but you have to ask to find out what they do offer, because if you go in and you're not a candidate for LASIK and that's all they offer, they're going to say you're not a candidate.
Yeah.
And they might stop there and not let you know what some of those other options are.
We just have another comment from Maria Ruiz, who said that you changed her life.
Oh,
Yeah.
very nice to hear. Well, thank you. It's been a little bit overdue
Changed
here.
mine too.
It's been great having you guys on Facebook Live. Thanks for coming out west and visiting with us again. We look forward to future editions of
Definitely.
Survivor. If you guys make it back on, and you're welcome to come back on Facebook Live anytime. Thank you.
Yeah.
Thank you, Doctor.
You're very welcome. Thanks, guys.
Appreciate it.